Hello, my name is Dr. Rick Blackburn, and I'm a licensed psychologist in the states of Minnesota and Wisconsin, and one of the co-founders of Sumis Health, LLC. I am board certified in behavioral sleep medicine by the American Board of Sleep Medicine, and am a diplomat of the Board of Behavioral Sleep Medicine. These two certifications denote the highest level of training and certification a sleep psychologist can obtain. I've also served for the last 5 years on the board of directors for the Society of Behavioral Sleep Medicine, the national organization for sleep therapists, and I've been successfully treating patients for insomnia for the past 9 years using a treatment called Cognitive Behavioral Therapy for Insomnia, or CBTI. Our goal at Sumis Health is to bring insomnia care to everyone, everywhere, regardless of your access to a local provider. To do so, I've created an ebook called Isomnia, the Self-Guided Treatment for Insomnia. It offers the same information and guidance I use daily with patients in my sleep practice. At the end of this video, I'll give you information on how you can get a copy of Isomnia at a discounted rate. I also want to give you some practical advice you can start using tonight so that you can start sleeping better over the next few nights. Before we do that, however, let's talk a little bit about the problem of insomnia. Everyone has experienced occasional nights of trouble falling asleep, waking up too frequently or for too long, or possibly waking up much earlier than usual in the morning. In fact, it's normal to have 1 or 2 nights of poor sleep during any given week. Typically, we can identify causes for those bad nights. Maybe it's increased work stress, family conflict, being ill, sudden changes to your sleep schedule, travel, or even sleeping in a strange bed. While you may feel more tired than usual the next day, you're generally able to function normally and return to your normal schedule and quality. Chronic insomnia is different. It is a serious medical condition that can cause significant impairment in life. While everyone has the occasional bad night of sleep, approximately 10% of the adult population suffers from chronic insomnia. Chronic insomnia involves difficulty initiating or maintaining sleep at least 3 nights a week for more than 3 months and results in significant daytime impairment. While the frustration and anxiety of being unable to sleep are bad enough, chronic insomnia worsens other medical conditions and increases the risk for developing future medical problems. When occasional sleep problems progress to chronic insomnia, previously used treatments become ineffective, and it's highly unlikely that sleep will improve to normal quality without treatment. It is very common in clinical practice to see patients who have suffered from chronic insomnia for decades. In 2015, the American Academy of Sleep Medicine reviewed literature on sleeping too little or sleeping too much. They released a consensus statement indicating that for most adults, 7 to 9 hours is ideal. Sleeping fewer than 7 hours has been found to negatively impact health and is linked to weight gain and obesity, diabetes, high blood pressure, heart disease and stroke, depression, increased risk of accidents, increased errors when completing tasks, increased pain, and impaired immune function that can lead to illness. Inadequate sleep has also been shown in other studies to increase the risk of substance abuse and suicide, impair attention, and negatively impact memory and the ability to learn new information. Reaction times are slower, lung and kidney function may be impaired, and appetite may increase. In some studies, sleeping fewer than 6 hours increased the risk for certain cancers. Short sleep is also linked with increased inflammation and may worsen conditions such as fibromyalgia, chronic pain, or arthritis. Sleeping too much can also be a problem. Sleeping 9 or more hours a night may be okay for some young adults or people recovering from an illness or sleep debt. However, sleeping more than 9 hours on a regular basis for those who do not fit into one of the before-mentioned categories may indicate health problems or another sleep disorder, and you should speak to your healthcare provider. Currently, it isn't clear if sleeping more than 9 hours can increase the risk of illness itself or is the result of already having poor health. When it comes to treating insomnia, short-term restriction of sleep that may be less than 7 hours and is used to overcome insomnia has been found to be safe for most people. So although we say getting fewer than 7 hours of sleep can lead to serious health problems, you may safely do so during a CBTI program such as isomnia. Now, earlier, I promised you something practical that you can start doing to sleep better within the next few nights. The technique is called stimulus control. It was first introduced for sleep in 1972 by a psychologist named Richard Bootson. It was the very first effective behavioral tool to treat insomnia. Since then, it has proven time and again to be one of the most powerful treatments for insomnia. When it is combined with sleep restriction therapy, the two produce results that are typically better and longer lasting than medications. Stimulus control increases the likelihood of falling asleep quickly by getting rid of behaviors that interfere with sleep. It does this by establishing a consistent sleep schedule, strengthening the association between the bed and sleep, and eliminating things that get in the way of sleeping. It also helps reduce anxiety related to sleep. When people have difficulty sleeping, they get anxious about how the night will go and how they'll function the next day. Often, this anxiety increases as their bedtime approaches, and this anxiety then makes it harder to sleep. The rules of stimulus control are simple. 1. Only go to bed when you are both sleepy and intending to sleep, but not before your scheduled bedtime. Believe it or not, the time right before you go to bed is when the alerting signal from your circadian rhythm is strongest. We call the 3 hours before your normal bedtime the forbidden zone. If you go to bed in the forbidden zone, you are more likely to either have difficulty falling asleep, or you may fall asleep and then wake up an hour or so later and be unable to return to sleep. 2. Use the bed for sleeping and intimate activities only. Do not read, watch TV, eat, or worry in bed. You want the bed to signal sleep, not activity. 3. If you are unable to fall asleep within 15 to 20 minutes, get out of bed and do something enjoyable and relaxing until you feel sleepy. This is also the rule if you are awake during the middle of the night for more than 15 to 20 minutes. Do not lie awake in bed. If you do, you'll start trying to sleep and get very frustrated. The harder you try to sleep, the more frustrated and anxious you will get, and this will make it harder to sleep. Remember, we want the bed to signal sleep to happen quickly. Number 4. If you go back to bed after being up for a while and you still cannot sleep, get up again. Do this as often as needed throughout the night. It may be a long night and you'll probably be very tired the next day. But if you follow the rest of these rules, you'll be more likely to sleep better in future nights. Number 5, set your alarm and get up at the same time every day, regardless of how much sleep you got the night before. This is one of the most important rules. Do not sleep in after a bad night or on your weekends or days off. Also, don't hit snooze multiple times. If you do, you'll learn to sleep lightly and wake frequently. Getting up at the same time every day is the most important part of setting a sleep schedule. When you have a bad night, but you still get up on time, it creates greater sleep pressure and will make it easier to fall asleep the next night. Number 6, do not nap or sleep outside your sleep schedule. Sleep pressure drops off rapidly when you sleep. Think about it this way. You're awake about 16 hours during the day, and you sleep if you're lucky for about 8 hours at night. This means sleep pressure builds slowly when you're awake, and it drops off more quickly when you are sleeping. When you take a nap outside your normal sleep time, it reduces sleep pressure and makes it harder to sleep during the time you want to be asleep. The longer you nap, or the closer to bedtime that nap occurs, the more it will disrupt your sleep. If you absolutely must nap, limit it to fewer than 30 minutes and make it at least 10 hours before your normal bedtime. If you follow these 6 rules, each bad night increases the probability the next night will be better. For most people with insomnia, after 1 to 2 bad nights of sleep, the third night is usually better unless they nap, sleep in, or go to bed early. These rules are designed to keep you from getting into that endless cycle of sleeping poorly at night and then compensating by sleeping during the day. Finally, I promised you information on Isomnia, the self-guided treatment for insomnia, and a discount when purchasing it today. If you go to the web page at the bottom of the screen and click on the link to buy, use the promo code SLEEPTALK and I'll give you a 50% discount off the retail price today just for listening. This offer is good until July 1st, 2021. It also comes with a 30-day money-back guarantee, so you have nothing to lose. Give it a try. Isomnia is a self-guided program that uses cognitive behavioral therapy for insomnia and can reduce or cure your insomnia in 10 weeks. CBTI is one of the most powerful and long-lasting treatments for insomnia, and it is endorsed by leading physician groups as the initial treatment of choice. In July of 2016, the American College of Physicians reviewed all the research related to the treatment of insomnia and concluded that CBTI should be the first choice for adults before medications are used. It is highly effective and likely poses fewer risks to people than medications. Isomnia utilizes a range of tools proven to improve sleep quality and quantity. These tools include behavioral interventions such as sleep restriction, stimulus control, sleep hygiene, relaxation and anxiety management techniques, and cognitive techniques addressing dysfunctional thoughts and beliefs about sleep. Each of the before mentioned is a module in Isomnia, and when put together in one program, it is incredibly powerful. Isomnia brings CBTI into your home. In many cases, insomnia can be treated in as few as 6 to 10 weeks. Isomnia can also benefit people who have been on sleep medications for a long time. The FDA recommends approved sleep medications be used for short-term use only, typically about 4 to 5 weeks, and none of the sleep medications are recommended for extended use. If you are currently using medication to treat your insomnia, Isomnia can help improve your sleep while you work with your doctor to safely reduce or eliminate sleep medications. For most people, treatment success and completion with Isomnia have the following goals. First, you are falling asleep in 15 to 20 minutes on average. Wouldn't that be fabulous? You awake 1 time per night or less on average, and if you do wake up during the night, the time you are awake is less than 10 to 15 minutes. You're averaging 7 to 9 hours of sleep per night, and you feel well rested during the day. Your sleep efficiency, the percentage of time that you're in bed that you're actually asleep, is between 85 to 94%. This is what is considered normal sleep. If you found this video useful, please subscribe to this channel so you can catch future episodes of Sleep Talk with Dr. Rick as we demystify sleep and work to overcome your insomnia. Also, please feel free to share this with any family and friends you think might benefit from this advice. Until next time, this is Dr. Rick saying, make it a great night.